I'm Lenny Santacola with World at Work TV. Today I am with Jim Zajac from ST Microelectronics to discuss the Affordable Care Act and the Cadillac Tax. Jim, we've known that the Affordable Care Act in the last 5 years, there hasn't been a lot of employers dropping employer-sponsored coverage, although that was predicted. However, we have a pretty big controversial provision coming into effect down the road here on the Cadillac Tax in 2018. What's your take on this? A lot of surveys are saying that almost 50% of companies will hit the threshold in its first year, and soon thereafter, many more companies will follow. What's your organization's concern about the Cadillac Tax?
I think the large employers who have rich plans really are concerned about the Cadillac Tax. So just as background, which I think everybody is well aware of, whenever ACA was passed, Congress had gone through and established some thresholds associated with the tax. So those thresholds are $10,200 for individual coverage and $27,500 for family coverage. When they were originally put in place, people thought, oh, okay, I have enough room. I really won't be concerned about it. Well, when you take into consideration double-digit increase in medical costs over the years since ACA was passed, and you take a look at 2018, employers really started to get concerned when they started to crank the numbers and to see what the impact is associated with it. So organizations like ours, began to figure out, what can we do? Part of that is to shift costs to employees. So the normal ones that organizations typically look at is to begin to increase out-of-pocket costs for employees. So co-pays, deductibles, those elements are put in place. Some organizations have really been aggressive in their stance in moving forward with this. And they moved to something called private exchanges, which you've talked about before. That's where an organization will actually give an employee a pot of money, and then it's up to them to go through and figure out their medical costs.
Other than cost shifting and high deductible health plans and private exchanges, is there anything else that your organization is considering as we approach 2018?
I think as we look at 2018, and quite frankly, I think if the Cadillac tax goes through as planned, what's going to happen is that this is going to be a watershed event. It's going to be similar and tantamount to what happened with 401k plans and DB plans. So in the 70s, 401k plans were put in place. It didn't take until the 80s when organizations began to say, I really can't continue with the costs associated with my pension plan. And so I'm going to shift to a defined contribution plan, similar to the 401k plan. I think this Cadillac tax is going to be the event. The employers are going to say, I really can't afford to be in the business of providing medical plans. And what is it that we can do in order to be able to support employees? Because it is part and a critical component associated with the employee value proposition.
Other than going to a defined contribution approach, do you think, you said this is going to be a watershed moment, do you think now the prediction will come true and that employers will get out of the business of providing health care to their employees?
I think that employers absolutely will get out of the business, but they'll still provide the framework. So similar to 401k plans where the company sponsors a plan, figures out the network that employees can use. For the most part, employers will provide employees with monies, and then it'll be up to them. They will become the risk managers for the health plans. So that responsibility will shift from the employers over to the employee.
Let's talk a little bit more about the employee value proposition. You mentioned that a little earlier. Whether employers take the defined contribution approach, whether they do that in combination with moving to a private exchange, whether they get out of providing health care, whether they continue the framework in some form or fashion, what do you think the impact would be on the EVP, or the employee value proposition?
I think it puts everything back into play. Employers are going to have to take a look at the total rewards package and assess all the different elements. Because let's face it, if you shift costs over to employees, those are monies that are coming out of their pocket. And so rightfully so, employees are going to say, okay, if this is now my expense, then what is it that is going to happen? Is there going to be a trade-off in base pay? Are bonuses going to be more consistent? Is there larger participation in the company as far as equity? Are you going to provide me with other supplemental benefits that I can tap into, maybe voluntary benefits? those kind of elements. So that's why I think it's a watershed moment where the total rewards package really has to be reevaluated by every employer.
You mentioned about, the trade-off, if companies now need to supplement, the loss of health care and things
Yes.
like that. What do you think the impact would be on salary budgets? Salary budgets have been pretty flat, have very little wage growth. Do you think that most employees would be expecting a trade-off, and would employers be willing to give that, I guess? What's your take on that?
Well, nobody wants to hear about increased costs, and nobody wants to hear about fixed costs in particular going up. But I think it really sets the stage, and it makes logical sense that if I'm an employee and you're asking me to take the burden, not only the risk, but the financial burden associated with medical costs, there needs to be some kind of trade-off and some kind of exchange associated with it. So I absolutely think that there will be an impact on base salary programs going forward. Now, is it going to be a one-to-one dollar trade-off exchange? I'm not quite sure. I'm sure that there's going to be more discussion and things will evolve as we move forward. But I definitely think that it will impact base pay.
The other thing that we won't discuss here that could play into the mix and complicate matters is whether or not the government addresses the tax preferential treatment of benefits and the pre-tax benefits that both employees and employers achieve. That could really complicate the whole conversation.
Yes, right.
So, any predictions for the future of employer-sponsored health care? Looking into your crystal ball, do you see anything? Obviously, you talked a lot about the evolving landscape and no one knows what's going to happen, but any final thoughts on what you think the future holds?
I really think that we had to pay attention to what's happened on the retirement side. And I think that we're going to follow suit. So I think that organizations will begin to reassess their role in providing medical benefits to employees and look for vehicles in which the whole risk management component is shifted over to employees. So it's taken a number of years in the financial services industry for transparency and for people to develop their comfort level with managing the retirement risk. I think we're poised for an evolutionary change where employees need to understand the risk associated with medical coverage, assume that risk, and then carry that forward.
Based on that, what would be your one piece of advice to practitioners, that are sitting in the same role that you are today?
Well, other than lobbying your congressperson or your senator, clearly pay attention to the options that you have out there that are available to you. Begin the conversations now because 2018 isn't that far away, and begin to lay out a strategy associated with how you can address some of these issues.